Hi, this is Jim with National Senior Benefits. This is part of our video series on Medicare 101. In this video, we will show step by step how to get the best deal on your Part D drug plan. We'll start by going to medicare.gov. In the middle of the screen, you'll see an option for drug coverage, Part D. The last option is Find Health and Drug Plans. We're going to do a general search where you'll put in your zip code. You may have to choose which county you reside in. Next, it asks, how do you get your Medicare coverage? We're going to make a few assumptions, but we're going to go with Original Medicare. The other questions are optional. You don't need to worry about those at this time. And do you get any help from Medicare or your state to pay your Medicare prescription drug costs? And we click on I do not get any extra help. Now it's time to enter the drugs that you're taking. You can click I don't take any drugs, or I don't want to add my drugs now. However, to be the most accurate, you do want to list any prescription medications that you're taking right now. If you don't have a list of your prescription medications, please pause the video and get that now. As you start typing, the name of the drug will start to appear in the list below. Then it shows the dosage. You want to make sure that's correct. The quantity, if you take 1 per day, that would be 30 per month. If you take 2 per day, that would be 60. And whether you get it from a retail or a mail order pharmacy. Click Add Drug and Dosage. And now we can enter the next drug. Again, as you start to type, the list will come up. Click on the name of your drug, verify the dosage, the quantity, the frequency, and the pharmacy type. Add drugs. Again, start typing. Now that your drug list is complete, to save you from typing it again, you can write down the drug list ID number, and you can also set the password date. I recommend changing it to your birthday or some date that's easy to remember. Again, make note of your drug list ID and password date, and you can bring this list up at a future date. Now at the bottom, we're going to click My Drug List is Complete. Now you're going to select your pharmacy. If it's not on the screen, increase the mileage. Find your pharmacy. Now at the bottom of the screen, click on Continue to Plan Results. If you have a Medicare supplement or a Medigap policy, you want to select prescription drug plans with original Medicare. If you don't have original Medicare, you would click here or here. But right now we're going to continue to plan results. The plans will then be displayed, and you can choose how it's sorted. Right now it's sorted by annual retail drug cost. That tells you the amount of money you would spend in a year on your drug costs with this plan. The first two plans listed are not available in this area, so we'll go to the first available. Now this list is sorted by annual drug cost. This includes the monthly premium for the plan, any deductibles, and co-pays that are included. At this point, a few things to consider. The first one is, are all your drugs on the formulary? The formulary is simply the list of drugs that this particular plan covers, and it varies from company to company. If all your drugs are on the formulary, great, we can move on. If not, scroll down to find a plan that has all your drugs on the formulary. The next thing to look at is the drug restrictions. Some plans request doctors prescribe generic drugs before they prescribe the brand name drugs. At this time, it's very important to look at the monthly premium. The lowest premium does not always correlate with the lowest annual cost of drugs. Okay, the next thing we're going to look at is the annual deductible. To illustrate the difference between having a deductible and no deductible, we're going to select two plans and do a comparison. We're looking at two plans with similar premiums and similar annual costs. But one plan has zero deductible while the other has a $400 annual deductible. Here's how the annual deductible plays out with your monthly budget. With zero deductible plans, your monthly cost is very constant. For plans with the annual deductible, you must plan that into your budget for the first month or two, depending upon which plan you choose. At the bottom of the page are clickable links for quantity limits, drug restrictions, and also tier information for the drugs, whether they're preferred or generic. And now to give a quick example of someone who might not hit the donut hole by simply removing one of the drugs. The plan with zero deductible, the monthly cost is the same every month. For the plan with the deductible, it must be met first. In this example, the difference in the annual cost of the drugs is over $200. At the top of the screen are the numbers directly to the companies. However, what I recommend is calling Medicare directly, or if you've made it this far, you can simply click the Enroll button and enroll yourself. The reason I recommend calling Medicare direct is simply to avoid being sold something that you don't need or don't want. If you call one of the companies direct, they'll more than likely try to switch you to a different plan and or sell you other products that you're not interested in at that time. Here's the number directly to Medicare. This number is manned 24 hours a day, Most people don't know that and call during business hours. So if you would like shorter wait times, you can call late in the evening or early in the morning. Okay, that's going to wrap up the Part D video for National Senior Benefits. Again, my name is Jim Rardin. You can reach me at the number or the email address below. If you have any further questions, please feel free to reach out to me.